Hello, future nursing professionals. This is Nurse Ed Scholar here. Today we're going to delve into the aspect of the considerations before conducting a nursing assessment. So let's get started. So when you are conducting a nursing assessment, you want to create a comfortable environment. You want to ensure privacy and comfort for the patient. So you want to make sure you take into consideration room temperature. Is it too hot? Is it too cold? The lighting. Are you going to be able to visualize the patient's skin or that wound effectively when it's time for that assessment? You want to make sure that you minimize any kind of distractions like extra noise or any kind of objects that may distract the patient. And you want to make sure when you're thinking about, doing your nursing assessment, appropriate social distance, eye level. You want to make sure that you communicate effectively when obtaining that history and physical. And with that, that goes into being able to communicate effectively using those therapeutic communication techniques that you're going to learn, using those open-ended questions for gathering that information. You want to ask questions about the client's symptoms and their concerns, and you don't want them to be yes, no. You want them to be open-ended. And then you want to allow for time, time for the client to respond. You're not trying to rush the client. Um, Also, with that, you need to understand, are there any kind of cultural diversity issues? You want to recognize religious, cultural characteristics. Are there any language considerations? And is there a need to have an interpreter? I mean, sometimes, we're in the hospital and if someone needs water or do they want to sit up, if you are familiar with the language. But however, when you're trying to gain crucial information regarding the patient, their conditions, and their concerns, you need to make sure that you're provided with the ability of getting in touch with the medical interpreter because you want to understand the values and the beliefs of your patient or with health practices that they participate in. Okay. So, you need to consider these things for a successful assessment. Now, when we're thinking about considerations with an assessment, you want to make sure that your attention is on your patient. We want to document everything, and the EHR, the electronic health records are great for efficient documentation, but you want to take that note taking, keep the note taking to a minimum. So as you begin in your nursing journey, you're going to become skilled with memorizing a lot of things about your patient, because you want to make sure that your client remains the focus of your attention. And as you're gathering this information from that history and physical, that's how you're going to choose the right assessment. Am I doing a full head to toe assessment? Is this going to be a focused assessment? What am I going to do? Because these assessments are going to be tailored to your client's needs and attention. And, also a big component of the assessment process is understanding how to perform a SOAP note. And SOAP stands for subjective, objective, assessment, and plan. So, you want to make sure that you document effectively the information that the patient gives you. You want to make sure that you document, those lab, values or those vital signs with that objective data, the assessment, your physical assessment, and then what type of plan of care you're going to provide for this patient. All of that has to be documented effectively because other people are going to be reading your documentation, other healthcare providers, other nurses. And so you want to be able to articulate your findings uh, effectively because, these SOAP notes can be used for health histories, physical exams, diagnosis, like I said, plan of care strategies. All righty. And then we're going to move into, you know, why is this all important? We're kind of talking about soap notes. So why is it important? Why is it important to master the soap note? You know, because this is where you get your information of how you determine your plan of care. Looking at what the patient is telling you. How are you using that information to determine the diagnosis? Now, yes, as nurses, we do not diagnose and treat. However, when you're hearing certain concerns or symptoms of a patient, it should kind of jog your memory. Oh, it may be this. Oh, it may be that. And that's how you're going to determine your plan of care. Um, and this information has to be communicated clearly and concisely through your notes. Um, you're going to have to be in tune with how to interpret Black history and physical, um, and how they go with each other, because how you gather that information from your history is going to determine what parts that you're going to focus on your physical assessment. Okay. And with that, you're not just writing an initial assessment. Your SOAP notes are going to be continual through your the care of your patient, because as the client's condition changes positively or negatively, you're going to have to document those changes. Okay. So that's just kind of a quick overview of the considerations that you're going to have to uh, think of when it comes to a nursing assessment. Uh, you know, as I conclude, I want, all of you to remember that the development of your history taking and your physical assessment is really the backbone of your nursing practice. So really think about that. So I hope you found this helpful. If, thank you for watching. Please like, comment, and subscribe. I will be, having more videos for you. So until next time, happy nursing.